Well, welcome everybody. Thanks for having us. I have the great pleasure tonight to actually get to share the podium with a very, very good friend of mine. So not only do we get to talk about something I'm passionate about, but I also, Tanya and I have been friends for a very long time. And I was also had a tiny little part in making sure that she ended up here in this community. I think she phoned me and said, so what do you think about this place? So I said, it's awesome, you should come. So it worked out, right? Yeah. Fantastic. So we're going to speak a little bit about, or a lot about actually, Foundry, the Foundry initiative, both provincially and what's happening locally. And I'm going to kind of pass it over to Tanya when we get onto that local piece so that she can talk more about that. We'll try to keep it fairly informal. So we all know mental health and problematic substance use start early. 130,000 young people under the age of 24 attempted to access. This was 2012-13 statistics. We know that number is now higher. 1 in 8 young British Columbians between the ages of 0 to 24 will have a mental health challenge and seek services. And we know that those services at this point in time aren't there for them. We know that 75% of all lifetime cases of mental health disorders begin by the age of 24. So think about that. Most of those cases, most of those individuals that end up developing problematic mental health issues in adulthood or substance use issues, those things show up early on. They show up earlier in their lives, 12, 13, 14, 15, and 16. The challenge is those services aren't there for them right now. We don't have easy access to the services that they need. The services are gate-kept. The services usually don't kick in until those issues get quite severe. And that's, I think, one of the biggest reasons why we're seeing the kinds of community-based challenges we've seen around mental health, whether it's addictions and overdoses, or whether it's kids hurting or harming themselves. We know that those are serious issues and they continue to get worse instead of better. So we spend roughly almost $100 million a year on child youth mental health, serving 25,000 kids and adolescents. $100 million, and we're only getting to 25,000 of them province-wide. And what's the young adult, what's the line item for emerging adults? So this slide actually comes from global statistics and looks at when does mental illness show up versus physical health issues. And our mental illness typically shows up fairly early on in life and the physical health issues later. The challenge is right now, the way that the budgets are designed and the way that money's being spent is that money's actually not targeting those younger folks and it's not getting to them soon enough. So we recognize that this was a pretty significant problem and that kids weren't getting services. There's been an 85% increase in emergency department visits over the last 5 years. That's 2009 to 2013 for youth ages 15 to 19. And all kinds of things are presenting in those emergency departments. So we've got kids coming in that are simply distressed because of some particular incident that has happened, or that they're feeling like harming themselves. And the emergency ward is where they seem to end up in those instances because there just isn't anything else. There's nothing else out there for them. We've seen a 50% increase in inpatient youth admissions. So once they're showing up in those emergency departments, they're being increasingly admitted into hospital. The challenge being hospital is not a great place for those kids to be served. It keeps them safe and it will provide some services, but they're fairly quickly discharged out into community services, which may or may not be there for them. Typically 1 in 4 fentanyl overdoses or fentanyl deaths in BC are young people between the age, people aged less than 29 years. There have been 402 since 2012. That is a horrific and huge number, right? Think about that. 402 kids, young people, dead from fentanyl overdose. Our system's been described as fragmented and a non-system of care by Dr. Stan Kutcher, with young people and families struggling to find access points. And the youth tell us, I'm tired of having to tell my story over and over. Every service provider they go to, they start again and tell that story again. I need a place where people will listen, be able to help with anything that I might come in with. Having a place to talk to someone would allow youth to work on issues before they get worse. And a place like this, Foundry, you should feel connected to each other, a sense of community. And 80% of youth and parents in Canada believe an integrated youth services centre is needed in their community. So in 2015, a group of folks here in BC decided to set out to change that. Founding partners came together to scale one-stop shops province-wide, and those partners included the Ministry of Health, the Ministry of Children and Family Development, the Graham Beck Foundation, the Michael Smith Foundation for Health Research, Providence Healthcare, and the St. Paul's Foundation. We formalized Foundry as a proof of concept and confirmed funding both from the provincial government and also from these founding partners, formally and for capital for 5 new sites and $800,000 for research and evaluation. We launched an expression of interest in December 2015, and we had 25 applications from across BC. And 13 of those were shortlisted for convening phase. So basically what they did was went out and said, look, which of you communities are ready to have a Foundry site? And we had fairly strong interest. And from those 13 shortlisted, Penticton was among them. So in that first group of 13, Penticton was one of those sites. And then we went through another round and had to whittle it down to those 5 that would go through in the first phase. The application process brought together more than 100 partners. So you'll see some of the names of the agencies that were involved at the time: the ministries, the foundations, First Nations Health Authority, Vancouver Coastal Health, Interior Health, the John Howard Society, BC Housing. From the beginning, we wanted this to be a truly integrated initiative. We knew that in order to try to solve this problem or make a dent in it, that we had to bring those partners together. We had to do services differently, because if services stayed stovepiped the way that they had been in the past, we knew we weren't going to change anything. Nothing was going to actually be different in the end. So we had to have these partnerships. We had to have these people at the table, because that's what's going to make a difference in the long run for youth. By the end of 2018, we'll have 11 Foundry centers. So we currently have Campbell River, which was the first one to open, first of the new group. Kelowna, which is open, the North Shore and Prince George, the Vancouver Granville site, which has been opened for a while. It was kind of our proof of concept initial site, and Abbotsford, which will be opening later this fall. The phase 2 communities, so Victoria is opening shortly and will be followed by Penticton. We anticipate that happening in the fall, and I'll let Tanya probably speak a bit more to what that's going to look like. And then Ridge Meadows. There are 2 more sites that will be announced. We're just waiting on one of those sites. We know where that's going to be, and it's just a matter of lining up when the announcements will be. And there will be a site in the north, and we haven't figured out where that's going to be, but we're working with health authorities and the First Nations Health Authority there to figure out where that site should be, so we can have another site in the north. Our brand took about a year to develop. With hundreds of youth consulted. It's interesting. It's the very first time in my career I'd been involved in a branding process. I mean, as someone with a social work background, you don't get many calls to be involved in branding. So it was a new thing for me. I remember coming to some of the meetings where they brought youth into the room and asked their opinions and asked them to visualize what a site would look like and to give feedback on different ideas they had around the brand. And at the end of the day, actually, and this is the challenge with any process like that, we didn't have 100% agreement on, what the name would be or what things would look like. But in the end, what we landed on was Foundry. And part of the reason landing on that name, Foundry, was that what youth told us, and maybe with the exception of a place like Penticton that actually has a Foundry, because that's unique, that the name didn't really have any association with them of things that maybe people of my generation would associate, like something to do with metalwork or something like that. And so it had a fairly neutral tone for youth, and as they kind of got used to that and then saw the rest of what the meaning behind it. So we put a lot of thought and time, and the youth gave us a lot of feedback about the kinds of things that would attract them to a place like Foundry. That it's a place where you can find help and hope and support and find yourself. That you can forge new connections and new abilities, and you can forge your path for wellness. And it's a foundation for health and well-being, a foundation for who you want to be in the future. Welcome to Foundry. Foundry's vision is to fundamentally change the experience of healthcare in BC. And it truly is nothing short of that. Our vision is to transform access to health and social services for youth and families by enhancing the provincial efforts and partnering with philanthropic communities, ministries, health authorities, and community organizations like Tanya's, which I think are actually the linchpin. When I became involved in this initiative, I told the folks who had started the initiative that I thought one of the smartest things they did was to get those community organizations centrally involved as hosts for this initiative. That sitting it outside of the traditional health partners was a brilliant move, in my opinion. So we want to integrate and augment existing services delivered under the banner of Foundry. We want to establish a network of youth-friendly, one-stop shops that are branded storefronts. We want to provide core health services, mental health, substance use, primary care, and peer support, as well as social services, income assistance, housing support, and support for developmental disabilities, across all of those sites. And also e-services. So we're in the process right now of launching the e-version of Foundry, and Foundry Online is what it's going to be called. And the idea is that we want to extend that reach. I mean, youth and young adults live in a world of, well, not even all of us, I think, live in a world of a phone that has our, our worlds on it, that we can access all the information that Google can provide us in a millisecond. And also where a lot of youth actually engage, and where they find information, or where they might start to receive services or start to figure out where they want to go. So we knew we had to have a presence there as well, and that's now just rolling out. So that we can extend that reach, and over time, as we extend the number of Foundry sites, we hope that we're going to get to, well, every youth across this province eventually who needs these types of services. So we envision bringing together primary care, mental health services, youth and family peer support and navigation, substance use services, and social services. So for primary care, our hope is it would be like visiting a walk-in clinic to see a physician. You'd be able to walk through the door, and at certain times, and each center is going to work it out a bit differently, you'd be able to see a doctor right away, or a nurse practitioner. Or if you had sexual health concerns, you'd be able to see someone around a sexual health issue and get help right away for that. So we're co-locating, and the Kelowna Clinic is an example of having sexual health co-located within that center. Mental health services. So we want to bring together the services that are currently delivered by the Ministry of Children and Family Development in the communities, as well as Interior Health. So they, and folks probably know that the Ministry of Children and Families sees kids up to their 19th birthday, and then theoretically they would move on to adult services, though that's open question how that works depending on the circumstances. Though there are some health authorities that actually provide services to youth that are younger than 19, but it varies depending on where you are. So we want to bring those services into the site as much as possible so that those services can be integrated. Understanding that they typically provide services to youth that have fairly high-end, like more severe or more intense kinds of needs. So we knew there was going to be a gap there in terms of some of those other needs, and to try and bring in other partners to bridge that. Substance use services, so to bring the substance use services in the community for youth and young adults into the center and make sure that we had that integrated. And finally, though not least, social services, to make sure that we had adequate array of social services for youth, where it was around housing or income security or food security, to make sure those services were available. And I left what I think is probably the most important one to last, which is youth and family peer support and navigation. It's actually the reason why it's in the center. And we really envision it in the center. One of the things that's been inspiring about this project from the beginning is the degree to which we've tried to bring youth and family into the conversation and have them drive services. So if you look at even the governance structures of the existing sites, like Kelowna being an example, youth and young adults and family members figure prominently in how those sites are governed. They sit on the governance, within the governance structure. They have their own structures in terms of family advisory or youth advisory that advise the entire project. And going so far as, from their perspective, they want to see every policy. They want to see every piece of paper because they want to know that it's family friendly. They want to know that it's youth friendly. So the sites have really gone, I think, out of their way to make sure that that's the case in each of those centers, that it's a place not only that was designed for them, but continues to be about them, continues to be driven by what their needs are and what their interests are. So just a quick tour of the different facilities. This is the Granville Youth Health Center. It opened in March of 2015. As I said, it was kind of the progenitor to the ones that are there today. Soon to be Foundry Vancouver Granville, so they're just going through a rebrand to bring all of the Foundry pieces in. And that's happening just over the next couple of months. Foundry Campbell River, so they were the first of ours sites to open up of the new group. Beautiful facility. Interesting community to be in, smaller relative to some of the other communities that we were starting in. So to see how they've brought together services that exist in that community, which are not as rich as some of the other communities that we've been in, and perhaps in some ways more like what Penticton's operating scenario looks like. And so, but an incredibly strong partner in the John Howard Society that's operating it. They've been fantastic as a Foundry, as kind of the first one out of the gate. And I think they've done a really, really good job of helping to inform how this model looks now. North Shore. So this is the one that's operated by a health authority. So Vancouver Health Authority actually operates this Foundry site. It's a beautiful, beautiful site that they've set up there. And they have been open since roughly September is when they started opening their doors. They've got an interesting catchment in North Vancouver and that side of the channel to be able to serve that. And so far, they've had really, really strong demand in that community. Foundry Kelowna is a beautiful site. They really did a fantastic job of putting that facility together, complete with a mossy wall in the background, yes. That's what that green thing is back there. A beautiful facility, and I think what's been interesting about Kelowna, they've done a really good job in terms of bringing in some key partners like the University of British Columbia's social work faculty, and bringing students in to help support the walk-in counseling services. And I think that's been actually a pretty fantastic partnership, pretty amazing piece of work, and I think the students have done a fantastic job in that setting. Foundry Prince George, again, opened in July, so they've been up and running for a while as well. That one, actually, it's interesting. It probably has the most kind of First Nations flavor to it in terms of how they've designed it. They've used a lot of wood in that facility to try to bring out, and actually even the names of some of the rooms are themed after animal spirits and images that come from First Nations, local First Nations. So it is a slightly different look and feel in that center, a really, really neat place to go. Foundry Abbotsford, as I said, that one we expect in May to open up. They had some delays because apparently getting a place to set up in Abbotsford's a bit of a challenge to find that many square feet. So it took a while for us to get that one going. Foundry Victoria, which is going to be opening shortly. They have their facility. They were one of the original group actually that had come through that weren't in the first 5, but were in that first 13, that larger bubble. And they kind of kept going with what they wanted to do. So they were fairly close to being ready to open when we came back to them and said, okay, the next 5 are ready to move forward. So they're going to be the first out of the gate as the new group. And as I said, February is the anticipated time for them to open. Foundry Ridge Meadows, which the anticipated timeline around that would be sometime late this year. We're still working on locations and figuring out what that's going to look like. I'm working with the agency there. But I think that's another one that's got lots of promise. There's lots of need in that community. And Foundry Penticton. Yay! So there's a lot of buzz in our office right now. So I work in Vancouver with Foundry Central. We're located in Providence Health. There's lots of buzz about the new sites, but we are absolutely thrilled about Penticton. The work that happened before this even came along, Foundry, because of the YES initiative and other things that PDCRS has been involved in. And I know there was palpable disappointment when you weren't in the first 5. And the desire and will of the folks that were involved to keep on with that initiative and to keep moving with it and make sure that that youth stayed front and center in that. And so it was, yeah, I mean, it was, because I live here, I was extremely happy when we finally said, yay, Penticton's going ahead. We have a site, and maybe I'll leave it to you to talk a little more about how that's happened and what's been going on with it.
So as Warren said, we were extremely disappointed to not be included in the first round. But one of the things about these experiences is that there's often a silver lining. And now getting the opportunity to talk with the folks that went through phase 1, there was so much learning around how to bring something like this to fruition that I think we actually are in a better place now as a community in terms of our readiness, but also in terms of the learning that Foundry has done in order for us to be in this second group. I think things are going to go very, very well. So for those of you who don't know about our organization, the Penticton District Community Resources Society, as John said, soon to have another much shorter name to be revealed March 8th, by the way, has been in the community for over 50 years, providing supports across the lifespan, really. And one of the things that I think that positioned us well in terms of being selected as a Foundry site is our work in youth and family services over the last 50 years. So we've been heavily involved in the youth engagement strategy, providing a youth engagement worker who actually has been filling some of the gaps in the community around young people aged 12 to 24. And as Warren talked about, there's that time around 19 where things are very challenging sometimes to access services or find services. services. And just today I was in a meeting where someone leaned over to me and said, my friend has a niece who's 19 and doesn't really know where to go and is kind of stuck. And so the youth engagement worker was a great sort of resource that's not attached to any ministry funding and that kind of thing, that we could just sort of mobilize that very, very quickly. So our involvement with the youth engagement strategy has been key, not only for that particular position, but also for the engagement with the young people themselves. They have been key to this whole initiative, huge drivers, huge source of energy, and critical input as we've sort of continued to walk the path since not being successful with Foundry. They've really advised us in many ways about what's important to them. And one of the things when it came down to actually making the submission is they said to us, look, mental health, basic needs, and actually the third thing, emergency shelter, emergency beds, were the three things that they highlighted as the things that were the most important to them. And if it wasn't important to them personally, they recognized that it was important to their peers, and they saw others among them who were really struggling with those issues. One of the things that I really appreciate about the approach to Foundry, as Warren talked about, was the family engagement piece and sort of the youth and family engagement being at the heart. And we know that these kinds of struggles, mental health, substance use, they don't happen in isolation. They happen in the context of a system, and often it's the family. And so our organization has been involved in delivering family services for many, many years as well. We have a history of being involved with some street-level services, some programs many years ago called Reconnect, which was youth workers who worked in an outreach capacity helping to connect young people back to their families or caregivers or other caring supports. We've been very, very fortunate also to be involved with the school district locally. They've been huge, huge partners. And some of the services that we provide in the schools here really speak to what Warren was talking to about us understanding that we identify the mental health needs much, much earlier. We hear from the counselors in the middle schools, that 12-year-olds, 13-year-olds are engaging in things like self-harm and are really, really struggling. And so we know that there's an opportunity to intervene earlier in a more coordinated way. And we're really fortunate that we have the school board as a partner with us in this initiative. And we've just also been focusing with our counseling programs around youth who've suffered trauma and really trying to support them in a variety of different ways. So the organization was really well positioned in terms of the service array that we offer. But the bigger piece of us sort of coming forward was a collaborative partners table that was spearheaded by the Community Foundation around looking at youth services. And so when the opportunity for Foundry came up, or at that time it was called the BC Integrated Youth Services Initiative, the group of service providers actually asked our organization to take the lead in making the submission. So there are a number of partners. I'm not going to go through them all, but those of you who are from our community are going to recognize many of these organizations. But there were 26 partners that stepped up to say, hey, we want to be involved in this initiative. We think we can deliver some of our services from a Foundry site, and we also think that together we can deliver things better, more effectively, and provide better care. So we felt really fortunate that so many folks, expected and unexpected, really wanted to help. So in terms of other pieces of community readiness, you will have heard of the YES project, I'm sure, the youth engagement strategy. So that began in 2012, 2013 with a woman by the name of Rohan Crompton Bell, who passed away and left her estate to the Community Foundation and to the United Way. And the only proviso on that is that that money go towards helping youth become better people with their wellness and self-esteem. And so from that original bequest, the youth engagement strategy was born. And that's when we began engaging a variety of youth. At the same time, shortly after that, the Divisions of Family Practice was also spearheading an initiative called the Child Youth Mental Health Substance Use Collaborative. We love it in the social services to get the longest acronyms for everything possible.
Paid by the word.
Paid by the word, yeah. And really, this was a group of mental health practitioners, primary care practitioners, social service folks, gathering together to look at what is happening in our non-system of care, or our system of care, with respect to child, youth, mental health, and substance use, and how can we do things better. So one of the things, there were two pieces that really came from that work that were concrete products, and one of them was the SOS Let's Talk directory. Really what this piece was is, there were a lot of family doctors sitting around the table who said, look, we're an access point for young people and their families, and they often come in around one issue, but there's so much more. There's so much more than that, and there's an opportunity there to be more helpful to them, but things are really scattered and fragmented, and we don't know where to send people. So the directory was really a first attempt to sort of say, well, of all of these services, how can we at least capture them in one space and create some accessibility or some type of database that may assist physicians and the community, other practitioners, to see where the various services are located and how to access them. And I would say that probably had moderate success, because it's still another step in terms of people need to go to find something out and send people somewhere. So the second piece was a group of young people wanted to gather together to raise awareness around mental health and stigma. And they thought it was really important to tell the story, tell their stories, to help their peers understand that it's really important to be able to talk about what's happening in your life, and to really, as one person said it really well, we need to destigmatize struggle, was actually what she said. And Wayne actually made this video with the young people.
We are the generation leaving stigma behind.
So it was pretty impactful to see them gather together. That was played, I believe, in the Landmark cinemas before lots of the movies during Mental Health Awareness Week. And so proud of our young people to stand up and begin to leave stigma behind. The Community Foundation has also been central to the project, the YES project particularly, being our funding partner around buying a building to actually host Foundry as well as other youth services. And so they're in the middle of sort of 1/3 of the way through, both in our campaign time as well as in the fundraising, trying to raise $3 million to help us open the youth center, which will host the Foundry site. So to date, there has been $1 million already raised by the community. So that's incredible. So one of the pieces that I think is really exceptional about Foundry, and it's one of the pieces in our current model of care where we sometimes get stuck in, this is the service we provide and how we provide it. And one of the I call it the signature presence pieces of Foundry is the stepped care model. And this is a great sort of more complex diagram, but when I talk about this sort of simply, it's really about meeting people where they're at that current moment in time. And as things get better, to step down the care, or as things get more intense, to be able to step up the care. And so it's really that notion of meeting people where they're at and providing the right service at the right time, rather than the service provider saying, well, this is the service that we provide in the way we provide it, and this is why we do it that way. I don't know if you wanted to add more about that piece. So just in terms of the fundraising has gone exceptionally well. People have been really responsive to this idea of this kind of integrated care model. So there's a piece there from Kelowna where Prince George, Kelowna.
That's the North Shore one here.
That's the North Shore there. So all of the sites have had to raise funds to, while there was a good funding provided from Foundry Central to start up the site, still more funds need to be raised in each community in order to open the sites. So I'm glad we're 1/3 of the way there already. The Foundry has quickly gained public recognition, so that's the Minister of Mental Health and Addictions, Judy Darcy, who said, "We know that support for youth is critical upstream. That's where we need to make sure we're supporting our young people before they have reached a crisis point in their lives, investing in prevention, in intervening early when a young person is really struggling." And, you know, Warren talked about that in terms of where people are at in terms of accessing the services, and the sooner we can get to them, the more likely we are to be able to influence the trajectory and their well-being.
Yeah, and I think it's been heartening to see that there's been support as government changed. The support was there before and with the new government as well. So we've opened several centers under both governments actually, and so it's been fantastic that people see this. This is about people's lives. It isn't about the political points, and so we've enjoyed great support, and glad to see Minister Darcy's been very supportive of us.
I hope she'll come out when we have our grand opening. And the young people as well. So this is Amy, a young person who said it's awesome because when you show up to the health center, it's not just seeing your case manager or your psychiatrist. I find it easier to go to one place instead of going to many places to see a ministry person, someone for primary care, or attending a recreation group. Having described all the services under one roof is nice, but having awesome staff who treat you like a real person no matter what situation is totally awesome. And as I was driving up to my office the other morning, just before I left about a week ago, there was a young fellow who was slouched under our awning at the back door of our office. And so I got out of my car and I went and I chatted with him. And the very first thing that came to my mind is, this guy needs to go to Foundry. He had a whole bunch of different things that he needed, and he had no idea where to go, how to get them, and was probably about 19 or 20, sort of falling in that group of young people who often will fall through the cracks and no services fit best for them. So can't wait till I can send him over there. And I think one of the other pieces that's been incredible about the Foundry initiative, from my view, is the support also from the foundations. You know, locally we've had the Community Foundation, but also those national foundations like the Graham Beck Foundation, who Rob said, Foundry represents a unique opportunities for donors to support innovation in youth mental health services and to have an outsized impact by leveraging new funding from the province, along with the assurance of rigorous evaluation and support from the Foundry Central Office. And I mean, these guys are so engaged in what's happening in this movement of Foundry that, you know, leadership folks from the Graham Beck Foundation actually sit in on conversations that we have about how to move this initiative forward. And Doug from Kelowna has been an incredible support to us already in terms of sharing their learning around their fund development. And he said, we saw unprecedented creativity in how the community gave, how friends and families were engaged, how our messages of hope and action were shared. The opening of Foundry is really a testament to what can be accomplished when we work together. And you know, they really brought that spirit when our site was announced. They reached out to us and said, you know, hey, anything that we can share with you about our journey so far, we're going to do that, and that's already happening. So one of the pieces that's great also about being involved in a network of sites is you get to see some data that's aggregated across sites. And this is just some most recent stuff that talks about which are the most common service requested. And so you can see that the green bar there is the mental health services, so no surprise there in terms of that 1 in 5 stat, and that being one of the most requested services. And then the red being the primary care, and the orange the substance use, and the gray bar being the social services, and the white the sexual health. But what I took also to be very interesting about this in terms of the primary care piece is it's often the first point of contact for folks, young people and their families, or the family member without their young person. And just the opportunity to be interconnected with all those services and see them in one line together, regardless of how high the bars are, is a beautiful thing.
Absolutely.
And this slide I thought was super interesting as well, just in terms of the folks that have accessed the services so far from May to October. We're seeing more females than males as one piece there, but also the age group, really 17 to 20, is the predominant group that's showing up. And so we know that that's good in the sense of 17 to 20 is a group where transitioning to adulthood services are tricky to access, so that makes sense. But knowing that, it also gives us some information about how do we design services and promote access to services so that we're able to intervene even earlier.
These are the different bubbles that we have in Foundry Central Office. It's not a very big office. We have this kind of L-shaped corner in a building outside of Providence Health or within Providence Health. So we have research and evaluation folks, some service development folks, some operations folks. We have a dedicated fund development person. She's fantastic. I know she's already been working with you guys. Youth and family engagement. We have both a youth and a family engagement person that are working with us. I'm the knowledge mobilization person right now, helping to make sure that we get the training into the centers and have that happening. We have policy development and partnerships. We knew, back to that piece about if we want this to look different, we actually have to change the way that we're doing the work and change the stovepipes that kind of exist around it. So we have a person who's been absolutely amazing at working around the community and ministry partnerships to try to take the barriers down so we can bring people into the center and say, forget the badge that you wear. Let's just talk about Foundry and how we can deliver services here. We have our folks in project management that develop the sites, and we have a branding and communications person who was critical in getting our brand, our Foundry brand. So that's us. That's the Foundry Central.
And one of the things that I think it has been critical in terms of having a central office is really the opportunity to have folks talking to senior leaders in government. So we can talk to our local folks here about this isn't working as well as it could, or we could do this differently in order to improve things. But to have a group of folks who are directly connected to the most senior levels of government, being able to carry forward these messages consistently and saying, so that it doesn't become, it's not just about us here in Penticton, this is a systems issue, that there's a group of folks that's having that conversation at the most senior levels of government. It actually does give us the opportunity to influence and change things, and to have the conversations that need to be had at a level that they need to be had. One of the biggest challenges is moving to a fully integrated care along a continuum of mental health and substance use services delivered by multiple partners at each Foundry Center. And so I think that's one of the unique pieces around working with local community organizations, is that the local organizations will have the relationships with the partners. So the one piece of it is to be able to have the relationships, but even having the relationships, it's still incredibly complex because each organization may have a different structure, a different way of doing things. And so I think that's been part of the learning so far, is that, hey, this is tricky. Even if people want to work together and there's interest, sometimes there are, things that we didn't know. And it's a challenge to be overcome for sure. What does it take to get us towards the end of integrated care? And so there's sort of four steps there. One is engagement. The next is sort of that development piece, the initial implementation around testing some of these ideas, getting your systems working to move towards fully developed integrated care. And where we're at right now really is that engagement. So still engaging the partners, both in the other nonprofits, engaging young people, their families, but all of those groups will be involved in the design and the construction of our Foundry Center. So the other piece that I've found tremendously valuable about being connected to a network of folks is this research element, the developmental research. And so some research has already been done, and one of the key findings, which was not surprising to me, is it's all about relationships. And a couple of the key things there, really, as we start to build Foundry, it's Foundry Penticton, not Foundry PDCRS. And, we knew from our organization's perspective off the hop that really it wasn't about featuring our organization, it was about bringing together a group of people to try and serve this group a lot better than we are now. So, and that's quickly grabbed hold, I think, in each community. And I think the common branding and all those kinds of things just really help with that. And at the same time, the lead agencies are really central to creating, mediating, maintaining relationships, ensuring gaps are filled because they understand the community. They have the relationships to leverage resources and to collaboratively problem solve with the partners, and the partners are engaged throughout the process. So, and they have been since the beginning. For us, one of the pieces when we submitted our proposal is we actually gathered almost all the 26 partners around the table. We had a short timeline of about 3 weeks to put this proposal together, and we had 3 meetings with all the partners to design what we thought we could do together better than we were doing it by ourselves at that current moment in time. The other piece around relationships is assumptions about relationships are always important to clarify, examine, and respond to. So it's just that piece about relationships being central and important, and they, just like our marriages, they need maintenance and support and care. Another lesson is around Foundry sort of negotiating the tension between wanting to provide clear leadership and direction from Foundry Central and saying, hey, we do it this way, and then also inviting this collaborative process with partners, and then communities also having their way, and organizations maybe having their way. And so it's sort of been this tension of the two-way learning. So how do we be receivers and givers in that learning experience, and coming up with something. At the end of the day, it's really not about us. It's about what's going to work best for the people that we're going to serve. The short initial timelines are having long-term consequences. I don't know if you wanted to say a little bit about that, Warren.
We didn't want this to be cookie cutter, like a franchise. Like you came in and, here's your Foundry out of a box. And we knew that we needed our partners, the existing initiatives in the community, like the Yes Initiative. We need that. We need that energy. We need that engagement and involvement. So there was a piece about co-creating and making sure that although there are pieces that are common in terms of look and feel and brand and some of those core elements of services, we knew it had to be each community's Foundry. It had to be theirs, and they had to be able to express that creatively throughout how they designed it and how they delivered those services. And so for us in that first round, it was that back and forth about figuring out which pieces we needed to be more prescriptive, which pieces we could kind of let go and say, okay, well, you guys can create those. In terms of the timelines and long-term consequences, so we were under, obviously, lots of pressure to deliver, right? To have sites up and running, to be able to show that that investment was, paying off in terms of real people being served, and to have some. And because we were on such short timelines, and we're actually building pieces of it still, designing some of the clinical pieces, we've had to go back and redress some pieces and go back and figure out how to go through those challenges. So that's what it means by long-term consequences. So when we push timelines, we realize things don't get done the way they maybe should have gotten done, and then we have the consequence of having to go back and figure out how to make it right and how to make sure it's still going to work. So in some ways, I think you're right about saying there were advantages to being in the second group, because the first group had to live through a little bit of pain with us. So.
Yeah, I can see it now. And, I think, the other piece around that is just sort of in terms of having that many partners, there's a lot of moving parts. And so it's a very complex complex group of systems to try to bring together in one system. So no doubt there are challenges around that. And from community to community, I think there are challenges related to access and quality, which are different in each community. And, we've seen that already just in terms of talking to some of the other sites and saying, okay, well, what are some of the pieces of service delivery that you have in place? And they're saying, well, we've used this from this existing program, and this from that used to be that, and just sort of those kinds of conversations, and realizing that for us here in Penticton, we don't maybe even have some of those pieces in place. So our gaps and our challenges are going to be different. And same with in terms of access points are going to be different. Yeah, partnership and collaboration are hard work and need resources of their own. we were talking about that today in our strategic planning, actually, is, you know, our organization, for example, outside of this initiative has 16 formal partnerships where we actually are in relationship with other organizations to deliver the service. And in the doing of that, the services are better, but it does take more time and more resources to navigate those things. Absolutely. So some of the things I think that are being considered is a Foundry liaison position for new sites. I'm not sure in the developmental phase. Consider ways to share information with and between sites that don't involve meetings or email. It was one of the things that was, the warning that I got was, okay, well, you signed on for this now. There's going to be a lot more meetings, a lot more email. And so I think Foundry Central is always looking at ways to how do we streamline things, how do we make this efficient and effective use of time and get good results still. The next bullet is something that I just love. Foundry is still a work in progress. I think it always will be because I said it when I was at the last get-together that we had in terms of learning some of the pieces. It's like a giant learning organization. So it will always be a work in progress because we're always going to be learning about how it is that we can improve upon a service or do something better or meet people's needs better or differently. And I think there's still some grappling with what are the core components of Foundry. And I think just from my perspective, you might think differently, Warren, but at the beginning, it seemed like things were a little bit more prescriptive about what those services might be. And I think the learning from Foundry Central is there's a lot of good things happening in various communities that really support and assist and need to be considered in the whole continuum of support. So I don't know if that's a fair comment, but
That's fair.
So Warren talked a little bit about this, and this is particularly exciting to me. And when we had our announcement in December 15th, we had the formal announcement that Pentacle was going to become one of the next Foundry sites. After we had that public announcement, we had a gathering later that day with the youth, and Andrea, the youth engagement worker from Foundry Central, was talking about Foundry Online and working with BC Children's Hospital and some of the options that are going to be available into the future. And around that table of young people was the biggest, that was the biggest sigh and of joy when she talked about this piece. So I hope that they will always remember that you can't get a virtual hug, and that, you know, coming to places like Foundry in person is still going to be really important. But the online tools will also support, you know, after hours, and for some who that is the best way for folks to receive service, that's going to be a help. And for some people it is.
Part of what was going on at the same time as we were building these pieces and rolling out the first sites was an opportunity that we were involved in with some other groups nationally. So Centre for Addictions and Mental Health in Ontario, and several other national groups around the opportunity to create a national center focused on creating a global network for knowledge exchange. So FRAME is what it's been called, and it's to connect and engage and transform. So the power of knowledge, what we want to do is have a global network to be able to share practice-based knowledge about integrated youth services and put that into action in community. So the idea behind these national centers, which there are several of them for different topics. There are ones that deal with the North and others. But the idea isn't to generate new knowledge. So the belief is actually there's a lot of knowledge out there. The question is, how do we get that in use? How do we make sure that it gets translated and gets into people's hands and in ways that people can actually implement them? Because what happens in a narrow kind of university research setting doesn't necessarily work in Penticton, right? So how do we make that real? So this really is focused on our ability to be able to take information specifically about integrated youth health centers or integrated youth health services and make sure that gets shared globally.